The next is medication review. The most important thing, 40% people fall because they take the medicine they should not. Now, if you go to the Lord Google, and just Google Beer's List, B-E-E-R-S, Beer's List, that's Dr. Beer, who first propounded what precautions people need to take with regards to medicine and aging. The problem with society today and the system that is in place, we have multiple doctors, multiple medications, and the primary doctor is not trained. And none of the doctors talk to each other, and so the patient is dumping one medicine after the stomach without understanding the drug interaction, without understanding the long-term effects. And then we have this over-the-counter medicines. They read somewhere, the neighbor told them, they picked up a magazine, and most of my patients are physicians, by the way. So they decide, I took this. And so we have to be very careful of the medications. Vision exam, particularly field exam, is an integral part. As you get older, your field of vision starts decreasing. So if I'm here, I will not be able to see this after about 10 years because my field will go. So if there's something wrong there, so with the new lenses and refraction, they expand that field. So that is another critical part. And home safety assessment. As we get older, our glare and the light perception decreases. And therefore you should have good lighting, wires, and you can read about fall safety at home. There are many places that have that. The new drug for Parkinson's disease. Well, the medicines that you have now available for Parkinson's disease increase the level of dopamine in the brain. Now, all of you, I'm sure, have read already what is Parkinson's disease. You've got the corpus striatum. Those are stations that are central part of the brain, and they process whatever comes from everywhere, process them and send it to the brain. In Parkinson's, they don't do that. So you get multiple symptoms. Remember, we are talking about two problems. There's a degeneration of the nerves. We don't know whether it's genetic, whether it's an abnormal protein being manufactured, whether it's a chronic virus. Those are the three theories that now think that neurodegenerative disease like Alzheimer's and Parkinson's. And those cells that make those chemicals, we've enhanced the amount of that chemical called a neurotransmitter for the brain to function better. So those medicines, if you take Parkinson's medicine, what they do is, because the number of cells in Parkinson's have degenerated and some are slowly dying, the amount of dopamine and other neurotransmitters is decreased in the brain. And with these medicines, you increase the level of dopamine. The new drug for Parkinson's disease means, and this is not my words, this is from the Parkinson Research Foundation, the exercise increases dopamine levels. So the mechanism of exercise is the following. Your nerves live forever, till death of course. But once a nerve is damaged and dead, it has very little capacity to regenerate. So with exercise, your dopamine levels increases. It has been shown without doubt. And not only that, there are some neurotrophic hormones. Trophic means they supply nutrition to the brain cells. They have shown in animal models and about 16 research that they've done in Parkinson's disease, that these trophic hormone levels are increased. And they provide better nourishment to the cells of the brain that are dying. Your early symptoms of Parkinson's are movement problems, tremors, muscular rigidity, and freezing of gait. You're just frozen, and you just can't move. And some of the researchers have said that you start imagining that you have a bridge or a stone that you have to cross, or some loved one keeps a leg like this and you ask them to cross. And when they rethink that, they can do it. So what I'm trying to say is, there are alternate pathways in the brain that are available. There are 1 billion cells. So once group of cells are dying, you can bypass them by biofeedback and enter them through another pathway. That is what I said, beyond the pills. Right now, we have two choices. Either sit on your chair and watch CNN and Fox and suffer, or move. Move so that you can increase your hormones and your neurotransmitters. In Parkinson's disease, we always talk about rigidity, poverty of movements. What nobody realizes about the emotional part of the disease. And that is fatigue. Severe fatigue. Even just to stand up is difficult. And they get sad. We don't understand. But there is a lot of sadness and suffering that they will not tell you. And so once sadness seeps in, motivation is gone. And then you isolate yourself and you're lonely. Loneliness in geriatric medicine is a worse disease than the disease itself. So we need programs to allow these people to come out, to be together in a group. That's the goal. And so regular exercise program as a group makes them self-worth, empowers them, and maybe we can help them. In the book of internal medicine, chapter of Harrison, we came to the humanitarian aspect, and principle it's the Bible of internal medicine. And the chapter wrote, and I gave this lecture in a couple of countries to my students for the last 25 years. What is expected of a physician is the words of the author. Starting first page. Unfortunately, physicians don't read that. What is expected is for you to have scientific knowledge. That knowledge that nobody can surpass you. But scientific knowledge alone is not enough. With an abundant amount of information the patient provides you, with a huge lab data of hundreds of pages of past history and the laboratory abnormalities, X-ray abnormalities, different doctors treating medicines and all, you pick one part from that puzzle and you intervene in that patient, you make a great difference in the life of that patient. And that is called the art of medicine. What is expected of the physician? To have scientific knowledge and practice the art of medicine? No. He should also have the heart, the humanitarian instinct. And that is to reach out to these people who suffer. Now, we are coming to the balance part. We, Bob and John, who have joined us, and I've written their names there, they selected this name because we were getting confused. Like Tai Chi, patients don't want to go. As soon as you say a foreign word, something happens. The brain just shuts off. And we didn't want to play tricks with the people. We are just openly announcing we are using every single available international study from any part of the world to help our patients, to prevent them from going to the nursing home and lie down in the warehouses that are across the country and looking at the roof and spending the last days of their life when the curtain is dropping. We are developing our own protocols based on international studies and evidence. We are starting with balance 1. And what that means is, we want to ask a patient, can you stand straight, slow? And most of them can't. The test what you should do to assess your balance at home is called Romberg sign. That sign is as old as science, but they never put into geriatric medicine. You should ask your family member to be with you, or you stand in there is no corner. But if you have a corner, you stand there's a wall, you stand there. If you fall, you have support. And in a corner this way, you stand there, but you have a family member and a chair in front. And you put your feet together, exactly like this, and stand straight. And then you will find you're going like this. Those are bad cases. The other one is close your eyes, and you give a gentle push, they'll go like this. 80% of people after the age of 70 have this problem. Well, you cannot exercise them. How can you ask them to do all these movements? So you start with balance 1. You hold the chair and you go. And slow. Hold the chair, both hands, one hand. Within 1 month, you'll be able to stand on one foot.